There are a lot of good training programs in the United States of America for oral and maxillofacial surgery. There are some good training programs in maxillofacial oncology and reconstructive surgery, what we call MORS. There are 0 training programs that I know of right now in both those areas that teach the Millennium Laser, that teach LAPIP, that teach LAPIP, that teach biostimulation using a 1064 laser. And the laser is one of those things that allows my residents to provide a level of care in oral and maxillofacial surgery, which is the emerging standard of care. That allows me to have my residents graduate and be profitable and marketable, but also provide their patients the emerging standard of care. What I initially intended was for the treatment of peri-implantitis, almost exclusively, because I've been doing dental implants now for 35 years, and a lot of my personal implants have developed peri-implantitis. And that's a really hard thing to begin to accept, that somehow or another something that I did is failing. And then I started doing a literature review, and most of it is in the periodontal literature. One of the best articles is written in the early 2018 realm. I don't remember the author at the time. They talked about as little as 0.4% of peri-implantitis occurs in the first year, and as high as 85% after 5 years. I was like, okay, we got a lot going on here. So at that point, I was stimulated to come to the courses, get the laser, and use the laser in treatment of peri-implantitis. I find it the most fascinating, the most applicable, and the most groundbreaking, because it's not something we usually treat in or teach in oral and maxillofacial surgery. When I realized, as I began to learn the actual etiologies of peri-implantitis, and I'm discovering far more than what's even discussed in the literature, I began to say, okay, this is a great training tool for oral and maxillofacial surgeons. That they go to a program, they learn how to do all this wonderful maxillofacial surgery, and we're doing dentistry in the form of dental implants, and now these things are failing. They need to have a tool to be able to address that. But what I'm prepared to teach them, and what our team of teachers is prepared to educate them in, is what is the proximal cause, or what are the proximal cause in a particular patient. So before they ever pick up a perio laser, they're gonna back up and say, why is this implant failing? Before I ever turn that machine on and put my goggles on, what is the cause of it? Because I want this to work. Because if you can't identify the cause, you might as well not start. If you don't have a diagnosis, you might as well not start treating a patient. You need a diagnosis to do that. So what I'm interested in teaching my residents is that part of dentistry that is uncommon for them in education and training. That there is more to oral and maxillofacial surgery than surgery. There is the dental part. And we need to be just as embracing and proud of our dental history as we are our surgical history. We have to go back to our roots and say, we gotta learn how to clean teeth. We gotta learn how to do peri-implant, treat peri-implantitis. We gotta learn how to use a laser. Those things are really important in the broadest aspect of what our specialty is. It's a tool to redirect my residents to their roots in dentistry.